My name is Denise Wunderlich, and for the past 25 years, I've been working in the mental health profession. I've worked as a mental health counselor in a variety of settings. I've worked in psychiatric hospitals, I've worked in residential treatment centers, and I've also worked as a private practice therapist. And most recently, I guess it's not that recent really, but I've been working in the employee assistance profession, and I've been working for the same company for the last 10 years. So, this past May, I turned 50, which was cause for celebration, except that we had this huge shadow. The day that I turned 50, I was in my doctor's office and got the news that I had been diagnosed with Hodgkin lymphoma. Well, that was a total surprise. That really came out of left field, as it would for anybody, but I certainly wasn't expecting that. Um, so, when you get diagnosed like that, you get the bad news, then all kinds of things run through your head. But the last thing that runs through your head is that you're going to have to worry about your job or insurance or anything like that. And since I've been gainfully employed and have insurance, in fact, in my employee situation, I'm actually in a union, the UAW, and I laugh because I never thought as a counselor I'd be in the UAW. But Detroit as you know, is a very big union town. And in order for my company to contract with some of the automotive companies, they had to unionize some of the staff that worked with the automotive companies, and that would be me. My account is with Ford Motor Company and General Motors. But anyways, so I felt pretty confident that I was situated. I really, my mind did not go toward insurance or any kind of financial consideration. You're pretty shell-shocked. And one of the things that I learned in going through this experience is that as soon as you receive a diagnosis, um, things start to happen at an amazing speed because you're immediately the clock starts ticking. You're racing against cancer, and depending on how aggressive your cancer is, sometimes it's amazing. They want to do things like immediately, or preferably even yesterday if they could. So in my situation, I got thrown into having to get test after test after test. And needless to say, a lot of these tests are extremely expensive. But what they were doing is what they call staging the cancer. They needed to find out how aggressive the cancer was, where the cancer was originating from, and whether or not the cancer had traveled from its source of origin. Now, I turned out to be really lucky because my cancer is not, my cancer is very treatable. And I ended up getting a lot of good news through these tests. But believe me, as you're going through these tests and the preparations for them, and they tend to make you sick, and then you're worried sick, and then the cancer itself is making you sick. The last thing you're thinking about is how am I going to handle this financially? Well, I thought I was in pretty good shape because of my job, and then it turned out that I had to go on short-term disability. I had harbored, I guess I'd say, and well, I don't want to say irrational because some people can do it, but I had harbored the hope that I could work part-time while I was going through chemotherapy. That's the treatment of choice for me. And after the first chemotherapy session, I found out immediately there was no way that I could work. I mean, it pretty much knocks me on my ass for about a week and a half. Then I get about 4 to 5 good days, and then I have to get the next chemo treatment. And for me right now, we're looking at 6 months worth of chemo. So I went on short-term disability. My company has short-term disability policy, which lasts up to 6 months. We do not have long-term disability. So immediately I started to become a little bit nervous, worrying, well, if this treatment takes longer than 6 months, I didn't know what I was going to do. But most importantly, when the short-term disability started, they also started what they call Family Medical Leave Act, FMLA. That's a federally mandated program, and employers have to stick to that. Well, one of the things that the FMLA does is it helps protect your job. In other words, they can't fire you while you're out sick, and they also forces the employer to have to pay your insurance premiums um, while you're out on your leave. Well, I didn't know this, even though I'm a union rep, and I should have been more knowledgeable about this, but apparently the FMLA only lasts for 3 months. So at the end of 3 months, your employer can then decide how they want to handle your situation. One of the decisions they can make is whether or not they want to continue paying your insurance premiums. Well, my employer, unfortunately, is not very generous. And so they've made the decision that they're going to stop paying my insurance premiums, even though I will definitely be out for another additional 3 months. So that puts me in the position of having to COBRA my insurance, which is extremely costly. Now, while I'm on short-term disability, my income is decreased by 33%. So I'm only bringing home 66% of what I was making before. And now suddenly I'm going to have to be able to find the money, or if I can't, I guess I would just simply be without insurance because I would not be eligible because of my age for Medicare. I'm not on long-term Social Security disability in terms of the government because I would not have reached the requirements for that, which are that you can't work for a minimum of a year or that your illness will result in a terminal situation. So it's an odd feeling to know that you're employed, you're gainfully employed, you've been employed for 10 years, you've had an excellent relationship with your company, your employer, and yet the first time you're thrown into a health crisis like this and you're fighting for your life, you're suddenly finding yourself fighting for a way to support your cancer treatment. And I found that really distressing. And I know that in the health insurance debate that we're having right now, there's a tremendous need for people to be able to feel that they can get through one of these illnesses, one of these life-threatening illnesses, without having to have undue financial stress. And really, most people would consider me one of the lucky ones because I am still employed in a city that has like 17% unemployment rate. And yet I find myself in a position of facing serious financial hardship um, because of the decision of my employer. That I feel that this, health insurance crisis is really um, unbelievably serious, and I really believe that it's a major force uh, in Americans trying to struggle to survive right now, and that we really need to get a handle on this and not let people hang out to dry, or bankrupt people, or have people face just incredible hardship because they've already been unlucky enough to contract an illness of some kind that's devastating, or their child has an illness. And I think that our government has to find a solution that's going to work for this entire country.